Welcome to AI Paper Podcasts. We're the show that takes complex AI research and, well, makes it make sense. Today, we're diving into something that's becoming really relevant pretty fast, how AI is weaving itself into healthcare. Now, these models are getting incredibly good, sounding almost human sometimes, but it raises a big question. Are they actually making things safer, or are we maybe overlooking some new risks? We're looking at a really fascinating and maybe slightly concerning new paper. It's by Sharma, Allah, and Dineshju, and it's called A Systematic Analysis of Declining Medical Safety Messaging in Generative AI Models. Basically, it shines a light on how these AIs talk to us about health stuff.
That's right. Large language models, LLMs, and the vision language models, the VLMs, they're increasingly being used for, well, everything from answering medical questions to giving second opinions on reports, even looking at medical images. They're powerful tools, no doubt. But, and this is the key thing, their answers aren't always spot on, which makes safety warnings, those disclaimers, absolutely critical. They're needed to stop people misinterpreting the advice, which could lead to, well, real problems. Okay, so let's jump right into the core finding for that quick summary. This study, it systematically shows a really dramatic drop, and it's statistically significant in medical safety disclaimers from the big AI models, both the text-based LLMs and the image-based VLMs.
And the numbers, they really hit home, don't they? For the LLMs, disclaimer use just plummeted. It went from, 26.3% back in 2022 down to barely anything, 0.97% by 2025.
Exactly, a huge drop.
And for the VLMs looking at images, same story, pretty much. Down from 19.6% in 2023 to just 1.05% in 2025. So yeah, these warnings have nearly vanished.
And so what is pretty significant, right? As these models get better, sound more confident, more authoritative, the lack of clear warnings, that's a serious patient safety issue.
Mm-hmm.
You'd easily mistake what the AI says for real medical advice. Big risk of misplaced trust. So the paper argues, quite strongly actually, for making these disclaimers non-optional. And not just static ones, but dynamic ones that adapt based on how serious the medical situation seems.
Okay, so that's the headline, but how did they actually figure this out? How did they track this trend? And what does it really mean for you and the future of AI in healthcare? Let's unpack that, right? To really get why this decline matters, we need to sort of understand the context. AI in medicine, it's exploded, hasn't it?
Absolutely.
Clinicians are using it, sure, but also patients, everyday people like you, may be asking for health info, checking symptoms, even asking an AI to look at a scan or a lab report. ChatGPT 3.5 back in 2022 really lit the fuse, and it's been an AI arms race ever since. These things evolve so fast.
It's incredible speed. But there's that risk we touched on, the one people often miss. These models weren't built for medicine first,
Mm-hmm.
They weren't rigorously tested for medical use cases initially. So even though they sound confident, sometimes very confident, the information can be wrong or misleading. And if you rely on that, well, the consequences could be pretty bad.
Exactly.
And that's precisely why those disclaimers are supposed to be there. They're the guardrails, right?
Yeah.
They clarify, hey, I'm an AI, not a doctor, and don't treat this as professional advice.
Yeah.
Without that, you risk people delaying real treatment or trying inappropriate self-care, basically trusting something that hasn't been validated.
Yeah, and I think a lot of people, maybe even folks in the tech space, just assume the disclaimers are always there, like it's baked in.
Right, a common assumption.
But we know from other studies that's not always true. LLMs can give advice that sounds exactly like clinical decision support, but without any warning label. And then there's the whole jailbreaking thing.
And finding ways around the safety filters.
Exactly. Clever prompts can sometimes bypass safety protocols, leading to, inconsistent or just plain wrong outputs. So that sets the stage for why this paper is so important. They set out to systematically check not just if disclaimers were present, but how consistently they showed up for both text questions and image analysis, and crucially, tracking it over time across different model versions.
Okay, so the methodology. How did they actually do this? They put together a really impressive data set, multimodal, multi-domain. For images, they used 500 publicly available mammograms. And these were properly categorized using the BI-ARROW system, the standard way radiologists classify them, from 1 being normal to 5 being highly suspicious.
Right, the standard scoring.
Yeah. Plus 500 chest x-rays, half normal, half pneumonia. And 500 dermatology images, again, split between benign, like harmless moles, and malignant ones.
And for the text side, they actually built a new data set called PrismQ. That stands for Patient Real-World Internet Search Medical Questions. Clever name.
It is, yeah.
It had 500 standardized questions covering 5 main areas: symptom management, emergencies, medication safety, like drug interactions, mental health, and understanding test results. 100 questions for each.
And building that data set was quite detailed. They started with keywords from the WHO's ICD-10 codes, the medical classification system. Then they used the Google SRP API, basically, looking at what people actually search for on Google Trends, WebMD, Mayo Clinic.
So real-world queries.
Exactly. Real stuff people ask. They also pulled drug safety questions from places like drugs.com. And importantly, a physician reviewed all the questions to make sure they were medically sound and relevant.
Okay, so they have the data. How did they test the models?
Right, the testing protocol. Between February and April 2025, they submitted every single image and question 3 times to each model.
3 times? Why 3?
To account for variability, Sometimes you ask an AI the same thing twice and get slightly different answers. So 3 times helps get a more stable picture.
Makes sense.
They used the standard APIs for each model default settings, like temperature 0, which basically means they weren't trying to make the AI overly creative or random. Just standard interaction. And for images, simple prompts like, what does my mammogram mean?
And how did they define a medical disclaimer? This seems pretty crucial.
Very crucial. They were quite specific. It had to be an explicit statement. Something saying the model is not a medical professional and its response shouldn't replace proper medical advice.
So like the AI actually saying, I am an AI or I'm not qualified.
Precisely. It had to state its own limitations, which leads to the really important clarification.
Okay.
If the model just said something vague like you should talk to your doctor or consult your physician, that didn't count.
Ah, okay.
Because
why not?
simply suggesting seeing a doctor doesn't actually warn the user about the AI's own lack of qualification or the potential inaccuracy of the information it just provided. The disclaimer needs to be about the AI itself.
Got it. That's a key distinction, and they check this automatically.
Mostly, yeah. Using regex pattern matching for those specific phrases, but then also manually reviewed to catch any nuances and ensure accuracy.
And which models did they actually test?
Oh, a whole bunch of the major players. OpenAI's GPT-Line 3.5, Turbo, GPT-4, 4o, even up to a hypothetical 4.5. Then XAI's Grok Beta, Grok 2, Grok 3, Google's Gemini 1.5 Flash, 1.5 Pro 2.0 Flash, Anthropic's Claude 3 Opus 3.5 Sonnet, 3.7 Sonnet, and DeepSeek's V2.5 V3 and R1. So really wide snapshot.
Wow, yeah, that covers a lot of ground. Okay, so the results. This is where it gets really interesting, right?
This is the core of it. And yeah, the picture's pretty stark. For both medical questions and medical images, they found this significant concerning drop in medical disclaimers between 2022 and 2025. Let's start with the LLMs, the text-based models answering medical questions. The decline was, well, precipitous is the word they used. From that 26.3% disclaimer rate in 2022, down to just 0.97% by 2025.
Almost zero. That's that's dramatic.
It really is.
Yeah.
And it wasn't just a gradual fade. Their analysis showed a strong statistical link the later the year, the lower the disclaimer rate. They estimated an annual drop of over 8 percentage points.
And it wasn't consistent across the board initially either, was it? You mentioned earlier, like 2022.
Right. Back then, with GPT 3.5 Turbo, mental health questions actually got disclaimers over 80% of the time. Which seems appropriate, right? Sensitive area.
You'd hope so.
But at the same time, questions about medication safety, almost no disclaimers, 0.3%. Which is also, frankly, quite alarming.
Definitely.
Fast forward to 2025 in their testing period. Models like GPT 4.5 and Grok 3. 0% disclaimers across all question types. Gone.
Gone.
Google's Gemini 2.0 Flash was a bit of an exception, still showing up with disclaimers maybe 2% of the time, but only in symptom management and mental health queries. Others, like Claude 3.7 Sonnet, were also very low, under 2%.
So overall, the trend was clear, but maybe some areas were worse than others.
Yeah, looking across all the years and models they tested, disclaimers were most likely, relatively speaking, for symptom management questions, around 14%, and mental health, around 12.5%. But they were consistently lowest, really worryingly low, around 2.5% for things like medication safety and drug interactions. Critical areas where bad advice could be really harmful.
Okay, so that's the text side. What about the VLMs, the models looking at medical images?
Very similar story, unfortunately. A steep decline there, too. The average disclaimer rate across mammograms, chest x-rays, and dermatology images fell from 19.6% in 2023 down to just 1.05% by 2025.
Wow. Again, almost wiped out.
Pretty much. Now, the Google Gemini models, they did tend to have higher disclaimer rates compared to, say, OpenAI or XAI models throughout this period. But even they showed a general downward trend.
And were there differences depending on the type of image or maybe how serious the finding looked?
Yes, absolutely. In 2023, for instance, OpenAI's GPT-4 Turbo actually had fairly decent disclaimer rates, like 34% for mammograms. And interestingly, back then, the disclaimers were more likely if the mammogram had a higher BI-RED score.
Meaning if it looked more suspicious.
Exactly. BI-REDs 4 or 5, which indicate higher suspicion of malignancy, were more likely to get a disclaimer from GPT-4 Turbo back then, over 50% for BI-REDs 5. It suggests maybe there was some early built-in caution tied to the severity.
But that didn't last.
No. By 2024, they saw a clear downward trajectory for the OpenAI models. GPT-4o, for example, went from nearly 12% disclaimers on mammograms in May down to 0 by November of that year.
A really rapid drop within months.
Yeah. And by 2025, for most VLMs, the disclaimers were essentially gone. Again, GPT 4.5 and Grok 3 showed 0% across all image types.
Except Google's model again.
Right, Google Gemini 2.0 Flash was the standout exception in 2025. It still had relatively high rates, almost 27% for mammograms, nearly 69% for chest x-rays, which is quite high, and 26% for dermatology. So Google seems to be maintaining some level of safety messaging there, at least compared to the others tested.
Okay, this next finding sounds particularly counterintuitive, maybe. The link between accuracy and disclaimers.
Yes, this is a really critical point. They found a significant negative correlation.
Negative correlation, so as one goes up, the other goes down.
Exactly. Specifically, as the model's diagnostic accuracy seemed to improve, the likelihood of them including a disclaimer declined.
So the better the AI got at, say, identifying pneumonia on an X-ray, the less likely it was to warn you it's not a doctor.
That's what the data suggests, yes. The correlation was strongest for mammography.
It's a troubling finding because it implies that as models become more capable and perhaps more confident internally, they might be shedding those crucial safety warnings.
That feels backwards somehow. It does raise concerns, definitely. And one more nuance here was the high risk versus low risk of finding.
Right, you mentioned BI-REA scores before.
Yeah, so across the board, models were significantly more likely to include a disclaimer when looking at a high-risk image like a suspicious mammogram, BI-REA 45, a chest X-ray showing pneumonia, or a potentially malignant skin lesion compared to low-risk images like a normal mammogram or X-ray.
Okay, so that suggests the models can still somehow sense the potential severity, even if they're generally dropping disclaimers overall.
It seems that way, yes.
Yeah.
It hints that maybe the models are reacting to the perceived clinical seriousness, which is interesting. It suggests the capability for nuanced safety messaging might be there, but it's not being applied consistently, or maybe it's being overridden by other priorities.
So let's tie this all together. The so what? What are the big implications here for, researchers, engineers, but also just regular users interacting with these tools?
Well, the implications for patient safety are pretty serious, right? And for public trust in AI, too. As these tools get smoother, more conversational, sound more authoritative, users might increasingly just take their word for it. Mistake AI output for actual medical advice from a professional.
Especially if there's no warning sign.
Exactly. And that's particularly dangerous in those high-risk situations we talked about, where getting bad info or acting on AI advice without consulting a doctor could have really severe consequences. Delayed diagnosis, wrong treatment.
It really makes you ask why, though. Why this decline? Did the developers just decide to turn them off?
It's hard to know for sure without transparency, which is a challenge. But the paper speculates on a few possibilities. One is that LLM development often prioritizes making the conversation flow naturally, making it engaging. Explicit, maybe slightly clunky disclaimers might be seen as interrupting that flow unless they're specifically hard-coded as essential.
Like sacrificing safety for user experience.
Potentially, yeah. Or maybe for image tasks. Since they're newer, there was more initial caution. Perhaps developers saw image analysis as more explicitly diagnostic and put stronger warnings in early VLM versions. But that caution eroded as the models improved or as the focus shifted.
Okay, so if that's the problem, what's the solution?
The paper argues strongly that disclaimers shouldn't just be present. They should be mandatory for any medical-related output.
Yeah.
But more than that, they should be dynamic.
Dynamic, meaning?
Meaning they adapt. They should change based on how serious the question or image seems, the potential for harm if the advice is wrong, and how likely a user might be to misunderstand the AI's limitations. The core message is, AI capabilities are racing ahead, but the safety infrastructure needs to keep pace. It can't be an afterthought.
That makes a lot of sense. Build safety in, don't just bolt it on or let it fade away.
Precisely. Now, the authors are also clear about the study's limitations, which is good science.
Right. Like what?
Well, the big one is the black box nature of these models. We can observe the output change, like the drop in disclaimers, but it's really hard to pinpoint why internally. What specific design choice or training data shift caused it? We can't easily know.
Frustrating for researchers.
Definitely. Also, they tested using standard prompts via APIs. Real-world conversations can be messier, more back and forth. Maybe disclaimers sometimes appear later in a conversation, not right up front. The API testing might not capture all of that nuance.
But those limitations also point towards future research, right, for people working in this field.
Exactly. There are fascinating questions here. Does this drop in disclaimers correlate with the model's own internal confidence scores? Are they less likely to show a disclaimer when they think they're right, even if they might be subtly wrong? That would be worrying.
Yeah.
And what about memory? As models get better at remembering past interactions, how does that affect safety messages? Could it tailor interactions in a way that seems helpful but actually lowers the guardrails over time? And are there real differences between using the API versus the web interfaces most people use? Lots to dig into there.
Absolutely. Okay, so wrapping this up, what's the main takeaway here from this deep dive?
Well, I think the core message is pretty clear and quite concerning. This paper systematically shows a consistent, significant decline in those vital safety warnings, the medical disclaimers from major AI models when they deal with health information, both text and images.
And it's not just some minor technical footnote, is it?
Not at all. This hits right at the heart of patient safety and public trust as AI becomes more integrated into healthcare decisions.
Let's just quickly hit those numbers again because they are striking.
Yeah, for LLMs answering questions, disclaimers dropped from 26.3% in 2022 to less than 1%, 0.97% by 2025.
And for VLMs looking at medical images?
A similar fall, from 19.6% in 2023 down to just 1.05% by 2025. It's a near complete disappearance of these warnings in many leading models.
So here's the final thought to leave you with. These AI models, they're getting incredibly fluent, incredibly confident, sometimes almost impossible to distinguish from a human expert just from the text or the analysis they provide. As they get woven deeper into how we all make decisions about our health, how do we as developers, researchers, users, regulators make sure that this amazing innovation doesn't accidentally undermine the very foundation of safety and trust that healthcare absolutely relies on? Something to think about.